Why would a dentist have his own perfectly successful root canal removed? Why have I not done a root canal on a patient in over 15 years? That's exactly what I'm going to tell you. And if you stay until the end, I'll share with you the one reason, the one and only reason I would actually recommend a root canal. If this kind of truth is what you're looking for, smash the like button right now. It helps spread the message to people who need to hear it, just like you. Most videos about root canals versus extractions focus on cost or pain or convenience. This isn't that video. I'm going to show you what happens inside that saved, mummified tooth, what the research actually shows, and why I stopped performing root canals years ago. By the end of this video, you'll understand exactly what questions to ask your dentist before getting a root canal. You'll know exactly why I chose extraction for my own mouth. And I'll tell you the one exception, the single scenario where I'd actually say yes to a root canal. I'll explain why the ADA, the American Dental Association, accepts that gum bacteria from periodontal disease travels throughout the bloodstream and causes heart disease, stroke, and is linked to Alzheimer's, but claims that root canal bacteria somehow stays perfectly put. There's a reason why European biologic dentists are growing 30% annually, while American endodontists are fighting documentaries in court. And I'll tell you what happened to my personal body within 24 hours of having my root canal removed, something I even never expected. Now, here's something they don't teach you in dental school, at least not the way they should. A root canal tooth is a dead organ, a tooth mummy. No blood flow, no lymph drainage, no immune access. It's necrotic tissue sitting in your jaw. Would you keep a dead finger or a gangrene toe? Of course not. But a dead tooth? We saved it. It's perfectly healthy. Here's the part that everyone misses. A tooth has approximately 3 miles of microscopic tubules, tiny little channels running through the dentin layer of the tooth. When you do a root canal, you remove the nerve and fill the main canals. But those tiny tubules, they can never be sterilized or properly cleaned. Modern DNA sequencing from a 2024 recent study, found between 347 to 566 bacterial species living in root canal teeth, each one producing its own toxins. Dr. Boyd Haley at the University of Kentucky tested over 5,000 extracted root canals, okay? Every single one, 100%, okay, contained bacteria producing toxins more potent than botulinum, the stuff that causes botulism. Really nasty stuff. These aren't fringe claims. This is a peer-reviewed research that the $2.7 billion root canal industry hopes you never see. If your root canal aches slightly when you're sick, that dull throb that appears with every cold, that's your immune system temporarily losing its battle against the infection contained in that tooth. The ADA and every major health organization accepts focal infection theory for gums. They agree bacteria from gum disease enters your bloodstream and causes heart disease, stroke, diabetes, and even crosses the placental barrier to affect unborn babies. We also mentioned Alzheimer's, right? Infections don't stay put. The bacteria and toxins in them travel everywhere. A 2024 Harvard review shows severe gum disease increases heart attack and stroke risk by 2 to 3 times. That's triple the risk. A 2024 JAMA, Journal of the American Medical Association study, found that P. gingivalis, a bacteria from gum disease, is in the brain of 96% of Alzheimer's patients. That's frightening. The ADA calls it groundbreaking research, and we have no way to remove or even kill that bacteria. Game over. Clearly, they fully accept that oral bacteria travels throughout the body and destroys organs. But somehow, magically, massive amounts of bacteria trapped in a dead tooth stays put. Minds its own business, doesn't travel anywhere. That's like saying smoke from a fire in your basement fills your house, but smoke from a fire in your kitchen stays put. Same focal infection theory, same types of bacteria, same bloodstream, same inflammatory pathway, but when it's a root canal, suddenly that's different. It's not different. It's a $2.7 billion industry protecting itself. Now, I had a root canal on tooth number 14 right up here on the upper left molar in 2002. It looked perfect on x-rays for 22 years. But here's what I noticed. Every time I got sick or had a cold, that tooth would ache slightly. Just a dull throb that appears when the immune system dips, then disappears when I recover. Probably sinus pressure, I told myself. According to most dentists, it's perfectly normal. Classic dental rationalization. I also lived with chronic lower back pain and neck pain for 2 decades. Just about every dentist does that, right? We're hunched over patients all day long. Occupational hazard, right? The headaches at the base of my skull were so debilitating, I'd have to stop working. I never connected these things. Why would I? My root canal looked perfect on x-rays. My back pain was from my job. 2 completely separate issues, so I thought. In 2024, after years of researching root canal toxicity, I decided to have mine removed by a colleague. I knew about the bacterial load, the toxins, the systemic inflammation. That's why I did it. I also understand the complete inconvenience of removing a tooth. That's why I waited this long. What I didn't expect is what happened next. The very next day after removing my root canal tooth, my back pain was gone. 20 years of pain gone. Not less, gone. My neck moved freely for the first time since dental school. Those skull-crushing headaches that I had, they vanished. I had no idea the connection was this strong. None. Tooth number 14 sits on the stomach meridian, which connects to the spine and neck. Chinese medicine mapped this 5,000 years ago. Modern German research has confirmed these pathways. I kept a toxic tooth for 22 years because it looked perfect on x-rays, and I blamed my profession for pain that was coming from my own mouth. That experience solidified why I don't perform root canals on my patients and why I tell every single one of them this story. So you ask, what's so bad about the bacteria in the root canals anyhow? Well, here's what nobody in mainstream dentistry wants to admit. Those bacterial toxins from root canals aren't just sitting there. They destroy the powerhouse of your cells, the mitochondria. Thioethers and mercaptans, compounds produced by anaerobic bacteria in dead teeth, destroy the electron transport chain in your mitochondria the exact same way cyanide does. Your cellular power plants literally can't breathe. Hydrogen sulfide from these bacteria binds to the same site where oxygen should attach. This crushes ATP production. Your energy production is wiped out. And here's the real horror. These toxins are fat soluble. They embed in your mitochondrial membranes and stay there, continuously disrupting energy production. If you have chronic fatigue, brain fog, and a root canal, there may be a connection worth investigating. When ATP production crashes, everything fails, right? Immunity, cognition, healing, detoxification. Your dentist calls it successful endodontic therapy. I call it mitochondrial assassination. So with all that stuff going on, you're probably wondering, why would you recommend a root canal? Well, it's coming up. Why does the industry fight so hard to protect root canals? Root canal therapy is a $2.7 billion annual industry in the United States alone. The average endodontist performs maybe 1,000 root canals per year at about $1,500 each. Probably more. That's $1.5 million in revenue per dentist just for root canals. It's not that difficult, just follow the money. Dentists make 5 times more doing root canals than extractions. And we all know corporate dental chains have quotas. It's a business, right? 5 root canals per week, miss your numbers, lose your job. Patients' health in this healthcare system is secondary to production goals everywhere. In 2019, a documentary called The Root Cause, appropriately named, was released on Netflix. It featured interviews with researchers showing the science behind root canal toxicity. Within weeks, the American Association of Endodontists mobilized. They pressured Netflix with threats of legal action. The film was pulled within 30 days. Think about that for a while. A documentary about teeth was censored faster than films about murder or corruption. What the Health documentary attacks the meat industry, still streaming. Fed Up attacks sugar, still available, but you question root canals? Gone. Let me give you the numbers. Dr. Weston Price, once head of research for the ADA, extracted root canal teeth from patients with arthritis, kidney disease, and heart problems. He implanted them under the skin of rabbits. Within days, these rabbits developed the same diseases as the patients. When he implanted healthy teeth, nothing happened. That was in 1920. The dental industry buried his research for a century. A 2024 study, 85% of root canals show periapical inflammation on 3D imaging. Infections at 2D x-rays completely missed. A 2024 study in the Journal of Clinical Rheumatology showed that removing infected teeth resulted in 65% reduction in rheumatoid arthritis symptoms within 6 months. What could it be? My personal clinical observation after 27 years confirms that removing infections is the single best thing you can do for improving your health. One important caveat, kind of like for entertainment purposes only. These are patterns I've observed, okay? Some people keep root canals and feel just fine. Their immune systems are strong enough to contain the infection for now. Others suffer for decades until removal brings relief. At some point, everybody's immune system gets tired and overloaded. That's when the strongest individuals feel the aching in their own infected teeth. The key here is informed consent. You deserve to know the risks, not just hear, "We saved your tooth." So what would I actually choose? Here's my framework, and it's the one I use with every single patient in my practice. Number one, if the tooth can be saved without a root canal through proper nutrition, ozone therapy, remineralization, prevention, save it. A living tooth is always your best solution. Number two, if the nerve is dead or infection has set in beyond control, I choose a biological extraction over root canal therapy every single time. That's why I don't perform root canals in my practice. Not on myself, not on my patients, but you get to make that decision for yourself. Number three, ideally, always place an immediate implant. It supports the bone like a tent pole does for a tent. Number four, when replacing the tooth, the space now, you have many options, including doing absolutely nothing. See the next video for details on options. All right, here we are. I promise you the one reason why I would actually recommend a root canal. Here it is. If you are in a situation where you absolutely cannot lose that tooth right now, maybe it's a front tooth and you have a wedding next week, or a critical business presentation, or you're under 24 years old and your jaw is still growing, or you're in great pain and you cannot make a decision right now because it hurts so much, go ahead, get the root canal, get out of pain, and make the best decision for the long term. But here's the key. It's a temporary solution, not a permanent one, in my opinion. I call it a long-term temporary solution. So if you're faced with the decision, should I get a root canal or an extraction? Here's what I want you to remember. A root canal tooth is a dead organ, harboring bacteria that can never be fully sterilized. The same profession that warns you about gum bacteria causing heart disease, stroke, and Alzheimer's denies root canal bacteria has any involvement. The industry has 2.7 billion reasons to keep you from asking questions. My own successful root canal gave me 22 years of back pain, neck pain, and headaches, all resolved within 24 hours of removing it. The one exception, when you need to buy time, but you know it's temporary, not permanent. And most importantly, informed consent means knowing the risks before you decide, pluses and minuses of both sides. Now, once you remove that dead tooth, you have options, and not all replacement options are created equal. In the next video, I'm going to break down exactly what happens after removal of the tooth, immediate versus delayed implants, implants versus bridges, partials, and why sometimes no replacement is actually the best and healthiest choice. If you found value in this, hit the subscribe button and click the bell so you don't miss anything. I'm Dr. Chris, the Detox Dentist, and I'm here to help you unlimit your health starting in your mouth.